Do patients leave going, I'm going to think about it after you present a treatment plan? Well, in this week's tip, we're going to talk about the right way to present a treatment plan. Stay tuned. Okay, so in this week's tip, we're going to talk about the right way. Now, there's many ways. Obviously, there's tons of ways to do it. But I talk to dentists all the time, and we go through scenarios, and we talk about why their case acceptance is what it is. And when I say it is what it is, we're talking about 20, 30% case acceptance. And before you scoff and say they don't know what they're doing, you don't know what you're doing either. Trust me. Tracking the proper metrics in a practice isn't native to a dentist. They don't do it very well. I'm hoping that you do, but we tend to find that most offices are presenting about 100,000 if we're using easy numbers, and they're only producing 20 to 40 of it. So that's a 20 to 40% case acceptance. And if I sit down with the dentist and I ask them, why aren't patients taking treatment? Almost one for one, they say they don't find it valuable enough. And that's not an incorrect statement because it's true. They wanted to go on the trip more than they wanted the dentistry, or they wanted to get that new car more than they wanted the dentistry. And so I don't know if value is the right word. It might be they don't prioritize it, and that is true. But it's not due to your inability to educate the patient. Because that's what I hear. Why didn't the well, they don't understand the value of it. Well, that would imply that you don't know how to educate your patients. And I don't think that's true, and neither do you. But I can tell you that from being the patient, I don't know anything about teeth except that I use to chew them. That's it. I use them to chew my food and eat, and maybe I smile, I get some confidence, it's great. What I tend to see is doctors trying to give their patients the education they've acquired over 4 years of undergraduate, 4 years of dental school, maybe a residency, maybe a specialty program, 10 years of actual practicing dentistry in under 7 minutes. And no patient's going to have your level of understanding of why this is important to do. So on top of that, no patient can understand the value of dentistry if you aren't telling them how much it costs. So every patient wants dentistry until they hear how much it costs. So a lot of doctors will sit there and they'll show them pictures. I met with a doctor last week. It was fantastic. I was like, they're going to open their practice. And I was telling him, you need to learn how to, attract and acquire patients and learn how to get them to want what they need. And I posed, hey, what's going to happen? You don't have the skill set. Patients come in. They're like, oh, I have this AI tool that explains everything. And I laughed. It was so funny. That's a doctor's solution to everything. If I take a picture, everyone's going to understand. No, they're not. Have you ever looked at the pictures? They all look the same to patients. They'll point to the wrong tooth if you ask them. Do you see what's wrong here? And they'll go, yeah, right there. They go, no, not that tooth. Why not? Because they're not a dentist. They don't know what they're looking at. You're not going to get your patient to have your level of understanding in under 5 minutes. It's just impossible. They're not going to come to the right conclusion. So when I sit down with doctors and I ask, what are you doing? I tell them they'd be better off to present less clinical. Patients don't need to know what you need to, what you know. If you were to sit down with me and go, hey, Jeff, you have 2 fillings on the left. I go, oh, okay. You go, okay, well, they're kind of shot. They need crowns. That's about all I need to know for now. The next thing I need to know is what? What would you want to know? How much is it? You got 2 fillings on the left. They're shot. You're going to need 2 crowns. They're roughly about $2,000. Maybe your insurance covers half. So now I know I need 2 crowns and it's $1,000. I may say something. I may start to ask questions. How can that be? Why? Are you sure? But they don't hurt. Now we're having a conversation, and guess what you have in your back pocket now? You have all of that clinical information to break out, piece by piece, when you actually need it, when the patient desires to know. Otherwise, you're just trying to educate them to death. And as you found out over the course of your career, obviously education doesn't work because most offices have a 20 to 40% case acceptance. So what I would tell you the right way, and there's many ways, but the sooner you can present a full treatment plan, the quicker you're going to get a real response from your patients. No patient could understand the value of it if you don't tell them how much it costs. And I don't need to know all the underlying issues to understand the cost. You could tell me the problem and how much it is to fix it. If I give you any sort of negative response, now you've got your clinical in your back pocket. Now you could break out a picture. When they say, how is that? And then you can point, now I'm interested in learning. So let's change the way we do this, okay? Try it on Monday, on Tuesday, on Wednesday, Thursday, whatever day you're watching this. The next day, when you have a patient, say as little as possible. Imagine they're a 6-year-old, because they are a 6-year-old when it comes to their dental education, and give them the problem, the fix, and the cost. And you will be shocked how quickly you get a real response from your patients. How could that be? How much is it? Why is this happening? But it doesn't hurt. All of these are real responses instead of what do you currently get right now? Like I really thought about it. No, all I could think about is leaving. All I could think about is getting to my next appointment. All I could think about is getting back to work or picking up Billy or, going to whatever concert, getting out of here. So put your patient to a decision, give them full information, spend less on the clinical findings. That's for you when the patient's actually interested, when they're ready to talk about it. And no patient will be ready until they know how much it costs. Try it on Monday. Let me know what you find out, okay? That's my tip for today. If you like that tip, smash the like button, the subscribe button, hit that bell so you're notified of any future tips. Thanks for tuning in. See you next time.